folks. And I do have to say welcome back, because this topic and our guest is so intriguing that this is the first time on the Wormhole that we have actually are doing a segment in two parts. So welcome back to the second part, where our guest is Professor Hariharan Seetharaman. And we've spent the last segment speaking about death. His specialties are critical care. And interestingly, his PhD is in health economics. And he has also been the past president of the Bioethics Society. That alone will tell you the broad range and the overview that he has on topics that are so dear to all of us as human beings. And after that first segment that we had with him earlier, what I'd like to say is that he's a true humanitarian as well. Welcome back, Prof.
Thank you. Thank you so much, Shireen. Thank you very much for having me. Many of my colleagues are now thinking that I'm not even an anesthesiologist, I am an ethicist, because I spend most of my time teaching ethics to students, and all my presentations in seminars and conferences are about ethics. So it's one of my favorite topics. And if I get a chance, I may do at least another degree in ethics, if at all.
That's what you call a lifelong learner. And Prof, like yourself, I find myself thinking, I wonder if it's too late to study neuroscience. There is so much in life to learn.
Yes.
I think we both share that passion, and you just wish you can know more. So I am going to get you started on ethics, as you're pretty much a specialist in that area. And what I want to ask you is, how do we really define, how do we know what is ethical? And my point is that during the history of humanity, during times of civilized society, civilizations have engaged in slavery, eugenics, and all of these things which we shudder to believe that these were the norm. But thankfully, we've come out of it. How do we know we have it right at this stage?
Okay. The interesting aspect of ethics is the conundrum of what is right and what is wrong. Okay, so
philosophy. I'm sure it borders on philosophy, right?
Definitely, it borders on philosophy. There is no dogma which can tell you what is right and what is wrong. And if you know that you mentioned slavery, and slavery was actually defended by priests quoting scriptures. And so that then they brought in an ethical dimension into it. And so those are the cultural influences. And I'm sure you would have learned about the Amazonian tribes. In their culture, actually, the debilitated, the very old people, they'll be killed so that they can be moving. And it is well accepted within their culture. So there are a lot of cultural variations to what is right and what is wrong. You can't exactly say that this is right and this is wrong. And that is the problem when it comes to the legality versus the ethical behavior. So some legal aspects may be unethical, and some ethical behavior may be illegal. So this is the conflict which comes when you clearly want to draw a line what is right and what is wrong. And the ethics, in my view, it's not only regional, and whatever I teach my students is I tell them that it is Western bioethics. Eastern ethics can vary from that. I'll give you a very simple example. Western bioethics, you would have heard about the 4 pillars of ethics. One is autonomy, okay? And the second one is justice, that is a distributive justice, not the criminal justice system. There's a distributive justice or a social justice. The third one is beneficence and non-maleficence. Okay, so beneficence and non-maleficence are very easy to understand. You always do good to others is beneficence. And you never think about doing any harm to anybody is non-maleficence. Okay, so those are easy. Distributive justice is a bit of a difficulty when it comes to our own healthcare. Okay, right? So there is a 25-year-old gentleman in the emergency department waiting to come into ICU because he had a head trauma. All right. And now we have a very critically ill patient, like the one which we were talking in the last episode, a terminally ill patient waiting there. Now, my justice, will it allow to pull the plug, as you called, or terminate care, withdraw care from the patient who is terminally ill to accommodate the young, productive gentleman who will be benefited from intensive care? This is a big ethical conundrum which we have to answer. And that is why, when it comes to these type of ethical decisions, I tell my students that it is always better to go by consensus guidelines and again effective communication. So the distributive justice is a very difficult topic in healthcare. When it comes to provision of healthcare, when it is available resources, do not discriminate it based on status, based on any category whatsoever, whether affordability or political affiliation or ethnicity, or you name anything. And so do not let any bias come into you when you actually treat a patient and provide healthcare to a patient. And that way you maintain the justice. And the first one, autonomy, is purely an American product, because autonomy is a one which dictates that, patients are the decision makers for themselves. Okay. Yes. Okay.
Right.
On the basic concept, I do agree that autonomy has its value, but there are cultural differences. And you yourself told me that the first one to know about your own dad's lung cancer is you.
Yes,
He did not
actually.
even know. He did
No.
not even know.
Yeah, and that's because we had some very close family friends who treated him like his dad, their own dad, which is
Correct.
why they told me. So, like you say, I'm not sure
Yeah.
if that was ethical, but
No, no, but that is what I'm trying to tell you. If it is in US, it is absolutely unethical, because they will say that the first person to know about their disease is the patient, and the patient should give consent to tell that to even the next of kin.
wow. So let me just tell you the rest of that. I have family all over the world. So my sisters we had not all been together altogether for 17 years. Yes, okay, that's the truth. They were in Pakistan and US and all over the world, Saudi Arabia. And the entire family was there at the time when dad's diagnosis came in. And I was the first person. They had arrived just days before. Prof, I decided that I was going to give my family a good, happy time. And I actually suppressed that information for about 2 weeks with consulting with the doctors if it was okay. And so that they can have a happy time till I
Correct.
broke news to everyone.
That is why I said it's a Western bioethics,
Yes,
because
yeah.
it's in their perspective. I own everything about me. I don't care about even my family, right?
Right, the
But we,
individualistic
we grew up
society.
differently. And this is Eastern society. I mean, recently, when I went to India, I watched a movie in the flight. It was a Chinese movie. And it's exactly the same thing, because the grandma will have cancer, okay? And the grandma will never know until she passes away.
Correct. I guess I am sharing some things that it's all after the fact, but I also have that situation where right here in Trinidad, my mom was diagnosed with uterine cancer, and they immediately acted on it and everything, and everything was clear. And the doctor told me that he went in there, he saw everything. It's totally clear. He said, if you go wherever you go, that's what they're going to. They will tell you to do chemo. They'll tell you to do radiation therapy, but it's your decision. But he said that he knew that he had seen that everything was clear. Harry, my mom passed away a couple of months ago, and she never knew she had cancer.
See, I fully admire you, Shireen, because that is how I would have treated with it. Because see, the ethics is one thing which we cannot go by dogma. We have to go by our feel. our feel to it. That last year my uncle passed away. He had COVID, right? And after COVID, he recovered from COVID, and then he was having, suddenly he had some pain, vague pain, and everything. I sent him for a scan, and I realized that he has pancreatic cancer. And his son, my cousin, lives in Atlanta. So I called him, and he didn't know that. Okay. And COVID came to our rescue. We told our uncle that the COVID has severely affected you. You have long COVID. So we are going to treat you for that as much as possible. But he had pain. We said that, even that is because of COVID. And we treated him. We kept him comfortable. We got somebody who practices palliative care in Chennai, and she could source some opioids for him, and he passed away peacefully in 3 months at home. And we brought in nurses at home. We never took him to hospital, and he never wanted to go to hospital, first of all. But he never knew that he died of pancreatic cancer. That is cultural. That is cultural,
It's
and that cannot happen in the Western. This one, that a doctor must disclose the illness, the ailment, to the patient first. That is what it is. So this creates a lot of conundrum. Again, the same thing, like, for example, we will be told here that, you have to go and give all the intricate details of the surgery and anesthesia in a way to the patient who is going to sign a consent in the preoperative waiting room. And so I will go. I mean, I go and say that, I am the anesthesiologist. What I'm going to do is that, I have to put in a needle into your back, and those details. When I go, doc, don't tell me anything. I trust you. Do whatever you want to do. So that is cultural,
yes.
because they don't want to know, and I cannot push that information onto them when they don't want to know. So this is what I'm saying. So ethics is purely cultural. But when I teach the four pillars of ethics to my students, I said, yeah, you need to know about it. You have to apply where it is contextual. You have to do it, and then anyway, you have to learn it to pass the exam. So otherwise, you have to contextualize it. You have to adapt it. You have to modify it to the region where you are practicing. And if a person wants to say, he says that, I don't want to know anything about it, tell my relatives. I can't say no to that, right? So these are the type of things which we encounter. And this, when we discuss bioethics as a dogma, it is always a problem. And it sometimes it conflicts with the legalities also. I'll give
Right.
you another case scenario. A lady with HIV was in the ward. Okay. And she made sure that, should not, nobody should disclose my HIV status to anybody in the family. Okay, that was her this one. And then the case notes was, nobody could see the case notes. We were treating her HIV, but she eventually, what happened is that she became suddenly very sick. Her lungs became, we call it a PCP infection, and she landed up in ICU. Right now, she is becoming, critically ill. Now the family is coming and asking what is her problem, because they have to decide what to do. Now her wish was that not to disclose the HIV status. Okay, but now we are in a conundrum whether to disclose it for them to make a decision. Number one. Number two, this lady has a spouse, has children, and they don't know their status. So there are four lives at stake: two children, and the husband and the wife in the critical care unit. So this is a big ethical conundrum. What to do? If I disclose that to the spouse, it is illegal. It is illegal because there is a recorded wish of the patient that status should not be disclosed to anybody. If she wakes up and comes, she can sue me. But if I don't say anything, firstly, they cannot make an informed decision about her care. Secondly, the more we delay the treatment for the kids and the spouse, if they are indeed HIV positive, that is actually endangering them,
Oh,
right?
yeah, what a situation.
Exactly. So this is where when ethics is practiced, when legality and ethics conflict each other, then we will have a problem. This is patient autonomy. She has
Right,
autonomously
right.
decided that no, should not disclose information. But we want to treat the kids. Kids have a long way to go, and it is treatable now. HIV is manageable. And once you give them the drugs, they are going to, their life is going to be normal. Only if they don't know the status, they are going to get into problem. So eventually, what happened? The inevitable happened. She passed away, and so immediately we informed the spouse and the to go and test for himself and the kids, and then if at all this one to go. But if it would have been prolonging, that would have been a big ethical dilemma for us.
So as we're talking on the topic of ethics and death, I think a very controversial area is assisted suicide.
Yes.
So, and again, as you've already indicated, that ethics is contextual, it's cultural. How do you see the case of assisted suicide? I imagine in Trinidad that is illegal.
Yes, it is illegal. Now, at least there is no legal statute to support it, and
Okay.
it can be charged with manslaughter, right? Now, I wanted to give you the distinction between withdrawal of care, okay, and then euthanasia, and then
Ah,
physician suicide. So withdrawal of care is what we commonly practice in the, we talked about the DNR situation. Remember, they do not resuscitate situation, or not providing any aggressive care in the hospital or in the critical care unit. Okay, and that is withholding of care. If I don't give anything, it is withholding of care. But if I am providing a care already and I am withdrawing it, it is a little one step ahead. So withholding care is what we call as an act of omission, and withdrawing care is an act of commission. So we have to actively go and withdraw and pull out the ventilator or pull out the drug, and that is withdrawing of care. But even that is not euthanasia, because we are not actively causing the death. We are just not treating the patient, and
yeah.
the pathology consumes the patient. When it comes to euthanasia or physician assisted death, you should be an active agent to cause the death. In that case, like for example, I reviewed a patient, a paper which came out of Colorado, because I think in one of those states, actually, the physician assisted death, PAD, is illegal, right? Whether a doctor who is actually trained to save lives can take away life. So that is the moral question and the ethical question. The legality comes with respect to the conservatism and the religious beliefs that nobody should be actively killed, for that matter. Where people may say that capital punishment should come, hang people, blah blah blah, and then when it comes to a crippling, very debilitated patient who don't want to live. This is the patient who had multiple sclerosis, and completely bedridden, infected, and so on. And the wife is begging the doctor to actually, give some extra dose of morphine that he will peacefully pass, right?
Mhm.
And the patient also wants it.
Mhm.
Patient is compos mentis, conscious.
Right.
Patients also want it. The wife wants it. Now, the because of the legal system, and also the probably their own belief system, they don't want to push the morphine. Although he wants to push it, he is hesitant. The doctor is hesitant. Now, the question is whether he will ask the wife to push it, under his. So what is the implication of that? You
Yeah,
know,
that will can still have he'll be complicit in the act.
complicit in that. Yes. So these are the things which are coming up, and then whether the wife will feel guilty that a physician not being giving, and I have to kill my own husband, whether that will stay in for the rest of their life, because for
Yes.
physicians we will be seeing so many patients like this. Okay, so these are very, very, very complex and intricate problems which they have to. But in my personal view, you know, um, a physician should be, should not be hesitating to, provide that service. In my view, if all the conditions are met. Okay,
Mhm. Mhm.
a conscious patient is not the criteria. It can be a conscious patient. There are patients with crippling arthritis, crippling organ failure. And, the patients who are, many patients don't even want to go on hemodialysis, and they'll be on hemodialysis and they will wait for something to happen to them. So, the humanistic perspective is that a doctor who is actually, we call it saving lives. For me, it is not saving lives. It is, it's healing and giving comfort to the patient. That is
Mhm.
all my thing. Is not, I cannot claim to be a god or somebody to save lives, right? With a supernatural power to save life. I cannot save life. All that I can do is that, give them a good quality of life, give them a healing from their ailments as much as possible, and keep them comfortable, pain free, and then in that particular thing, whether, if we reach a level that nothing from our armamentarium is going to give them any relief. Okay, people, we think that narcotics is the ultimate. Not necessarily. There is something called a opioid induced hyperalgesia. Some people get increased pain from opioids. Many different things, and then they get tolerant to opioids.
Right.
The
Yes. Yeah.
pharmacology go on increasing. So there are many factors which come in. So if a patient consciously decide that I don't want to live anymore with this disease, whether it is legal, okay, it is not legal in most countries. But even with those religious beliefs, I mean, certain European countries have come out of that, and
Yes.
with the humanistic perspective of actually helping the patients out, and that is where they have legalized physician assisted death. And I know that even in certain parts of North America, certain states, they have I mean, they have legalized, and there is a statutory support for physician assisted death. The the biggest dilemma, the all huge dilemma we face is that a doctor who is trained to do all the things to keep patients alive, how can the
Yeah.
doctor talk about death and talk about assisting death? Isn't it,
Yes.
contradictory to what they have learned?
It's not an easy issue at all, Harry. I've been following a lot of your work over some time, your writings and so on. In one of your articles, I read that you had quoted a statistic that surveys had been done abroad where people have been asked that if they had a choice to either die at home or in an ICU unit, what would they choose? You want to share a little bit of that?
Okay. Yeah, this was Time magazine survey, and this has been now. I mean, I read a lot of other countries also have done this, Canada,
Okay.
Australia, and I can tell you easily, the least percentage I have seen is 70%. That's in USA. All Australia, Canada, everybody, three-fourths, 75%, 80% of the people want to die at home.
That's interesting. So it hasn't been done in Trinidad or the Caribbean.
No, no.
So a project
No,
I can, yeah,
I think we should,
I
yeah,
can
a
send
project
for ethical approvals.
throughout the world, people want to die at home in their own room, in midst of their relatives, talking to them, And that is the best way to die even. I mean, actually, because if you see the way we hook the patients up in critical care unit, and
Yes.
it is so distressing to watch it. All these things are okay for a patient who can come back and have a reasonable quality of life, but we do this for people who are, already dying, and we are just actually doing this to keep those numbers, satisfactory. So
Yes.
that is
Yeah.
yeah. So that is why I think, you know people should be educated that, intensive care is not everything. Many of these elders go and stay at nursing homes, and when a senior elderly gentleman, has some problem, falls fainting or whatever it is, they call 911. So the EMTs come and then jump on them, and then, and then you just bring back the heartbeat, hook them up onto the machines, and then they take them to the critical care unit. And then they treat them for 1 week, and then they die. And to actually discourage this, to dissuade people getting into this type of death, there was an education program. People went into the nursing homes, talked to the elderly people, and said that, this is unnecessary, it is not needed for you, you will be hooked up into machines, and eventually you will die. So it is better that you sign the DNR right here, because again, only in those type of countries, because of the patient autonomy, they have to decide about themselves. So when they are compos mentis, they signed the DNR that, don't jump on me, don't resuscitate my heart. If I die in the nursing home, leave me peacefully, and the funeral will be taken care of by the nursing home people. So that happened in the US. But, because in different cultures, people die differently. Still, what I wanted to tell the people is that, hospital, healthcare, critical care unit, ICU is not the ultimate. It is not going to bring back everybody. And once you have reached a certain life, you must decide. And you can, and even here, even though there is no statutory support, if you have a living will, all right, mentioning that, I don't need any resuscitation, that has to be respected. The court will respect it, and it can be defended by common law. So the legal, you may not have a statute, a section in the legal books which will support a living will, but as a patient's desire, what he or she wants to undergo during their end of life, if they write a living will that, I don't want to be resuscitated, it can be defended in the court of law. So what I would do is that, I would actually campaign for this, because we shouldn't be, if you have reached a certain age, and we talked about it, with respect to my mom, your parents, and
Yes.
uh, and one day, once they have reached a certain level, they should be able to tell the relatives and the healthcare system that, you know do not touch me, do not touch
Yeah.
me.
It's
Let
really
me.
good. Yeah, good to hear that, Harry, because a lot of us laypersons don't even know that you can take that kind of position. It's really important for people begin to talk about this, understand the situations around it. As you talked about the living will, where if you do not wish to be resuscitated. But I think, in my opinion, there's been a lot of absence of conversation because death is something, it's a taboo subject.
To talk. Yeah.
All of us are going to have to deal with it, either for
Yes.
loved ones or ourselves. All right. So sadly, we can go on for hours. So I'm going to take a little bit lighter tone here and, well, not so much lighter. So just a couple more questions, but this segment primarily has dealt with the ethics and the morality and the legality around decisions, which is not easy at all. So what would you say is your utopian vision for healthcare? Big topic.
Yes, it is utopia. You use the exact word actually. But if it comes to me, I would go to the basic provision of simple treatments for simple ailments, the primary health care, and where we can actually bring back patients, like for example, trauma, accidents, and gunshots, whatever with trauma patients. These are patients where we can actually use the intensive care unit to bring back. And can you believe that the scientific report says that 60% of spinal surgeries are done without a proper indication? That is, I'm bringing it because there are lots of unnecessary surgeries throughout the world.
Wow. Wow.
Yes, there are lots of unnecessary surgeries which can actually come down. So what I wanted actually in healthcare is that there should be universal healthcare access, and
Mhm.
I put that in my conclusion in my PhD thesis. Just like food, water, clothing, and a house to live, healthcare should be a right, human right. Access
Absolutely. I'm with
access to
you
access to access
100%.
to basic healthcare. Access
Yeah.
to basic healthcare should be a human right. And if only governments reallocate their budgets, reallocate their resources, and do it wisely, you can allocate the money to take care of everybody in the country. That is absolutely no doubt about it. But because we want some fancy projects, and we do many other things, and and then we spend in war and defense, and here it's crime. Defense Ministry of National Security gets so much of a budget. So all these things. I feel that the society should think that we have moved to 2022 now. We are in the
Mhm.
2020s. Science have advanced so much, and this is not the time for killing each other. We can use
Mhm.
all those defense money, all those money you're going into crime and all that, into basic healthcare needs, basic drugs for people, to keep them going as much as possible. And that is what is needed actually. If the commercial and the commoditization of healthcare is gone, and if there is universal healthcare access and a proper resource allocation, and as a corollary, nobody is pushed into poverty because they have to have healthcare. That is my utopian vision of healthcare.
You're bringing tears to my eyes. So at this point, one of the things we do in the Wormhole show, Harry, is that we like to get into the mind of the scholar, what makes them tick, get to know you a little bit better. So I have a couple of questions for you. Tell us
Sure.
something about you that we would be hard pressed to guess.
Oh, hard pressed to guess. Okay. The thing is that I was brought up as a very orthodox a Brahmin, a priestly family. Wake up with devotional hymns for the gods, and even going to bed is after devotional hymns. And even now I remember all of them by heart, and that was my bringing up. But
Mhm.
I I am a complete non-believer nowadays. In that aspect is that I don't believe in an anthropomorphic God. I do believe that there is something in the universe which is pervading all our matter. Definitely. I mean, we are, as a physicist, that, we went into atoms, we went into subatomic level, and then we now looking at dark matter. We don't know. I mean, we are still exploring a lot of things. And when I read the physics books, they said at one point of them, they said there is nothing more in physics left. But every decade, new things comes in,
Yes,
and
each it's an onion thing since that's on my side of stuff. Every time you peel a layer, you discover a whole lot of other unknowns, and that
yeah.
keeps happening.
Despite all the chaos and the entropy and everything, there is some sort of an order which I am fortunate to look into the order of the universe. Like, I mean, there is some meaning to it, definitely. For
Yes.
me, I don't need the moral support. I am happy with the nature around me. I am part of nature, and I am going to be part of nature forever. All my molecules, everything, is. And my spirituality is my quest towards understanding the mystery of the universe. So my spirituality is not towards that anthropomorphic, worship type of thing. My spirituality is the quest towards the understanding the whole universe and the energy.
It reminds me very much of the sort of philosophical stance that Einstein also had. They taught it becomes a spirituality, a sort of a cosmic spirituality that you start to see. And even Carl Sagan, was a well proclaimed atheist, I think he used that label for himself, and I understand what you mean. There was always that there is some kind of religiousness that comes from nature, the understanding, and our part in it. Just this week, I was teaching lives and deaths of stars, and I told my students something that one would know, that we are all literally children of the stars. Every atom inside of you, Harry, came from within stars. But more powerful than that, I love telling people that the liquid, the whatever, the water inside of you, that hydrogen atom has been 13.7 billion years in the making. All the hydrogen that exists in the universe was formed in the first few minutes of the birth of the universe. And these are powerful thoughts of who we are. Right. And now it's formed. It's cosmos, opposite of chaos. And we have now formed matter, who can think and now question where it all came from. Okay, so yes, you are right. One would not necessarily guess that about you. Okay, so what gives meaning to your life?
Exactly the same thing which I told you, that when I think about, I have been allowed by nature to live to this extent. When I was in my 20s, I wasn't very keen on getting married, for example, right? I was thinking, what it's all a waste of time or something like that, monogamy and, whatever it is. Now, and then I realized that, if I live until this time and nature has allowed me that, I'm capable of procreation and sustenance of the species, the best ever if you see the anthropological development in a human anthropology, the best ever institution to actually do this is marriage. So that changed my perspective towards marriage, and then I got married, and so that actually that gave a meaning to my life when a family came in, and I have to live for my kids, and I am thinking of their life now. And then I tell them that the same thing is that if you they ask me, what religion do you follow, right? Everybody asks me that. Are you a Hindu? Are you a Christian, and so on and so forth? And then I tell them that my religion is harmonious living with everything around me, not every human being alone, everything around me. That is my religion. So if I am in harmony with everything around me, okay, that gives meaning to my life.
It's just beautiful and wonderful. So just part of the entire ecosystem and planet Earth and the universe by extension. Okay. I know you read a lot. I know that. What's one of your favorite books?
Okay. There are many of them, but the thing which actually pulled me into philosophy is one of there is a comparative philosophy book called A Concept of Man.
Mm-hmm.
If you had an opportunity, it was compiled. It was multi-author book. It was a Greek philosophy, Chinese philosophy, Indian philosophy, and Jewish philosophy. These are the four things which were, they epistemologically they were distinct. So that actually they pulled the concept of how human being was given importance in all these philosophies, the concept of man, and how each one of these distinct philosophy, Jewish, Chinese, Indian, and Greek philosophy approached this. And they also discussed about the theistic perspective, theological perspective, and and it a very comprehensive analysis of comparative philosophy. So it's a very very influential book for me. And then I had all this all other books, including Stephen Hawking, and you name everything, Feynman, and I mean Darwin's. I have the original, Origin of Species. That is a very very impactful book.
Changed the
And
world, changed, yeah.
yeah, so and I do read a lot of religious books too, even though I told you that I do not uh, subscribe myself to an institutionalized religion and a dogma, but I do read all the books. I have two copies of the Holy Quran. I have Bible. I have the Gita, everything, just to learn things that what was their perspective on those days, and how it can be related to the contemporary period, and so on and so forth.
Okay, that's really fascinating to learn. Just by the way, when I asked you the question, what would we be hard pressed to guess about you? I actually thought you were going to say playing steel pan. So for our audience out there, Harry is quite an accomplished steel pan player. Plays amazing music. I have been stalking you. So I've listened to some of the Indian music that you've played on steel pan as well. So now we know two things that we'd be hard pressed to guess about you.
I took part in crop over in Barbados, which is
Okay.
equal to this
Yeah.
mass and carnival, right? And I had my costumes, and I was everybody thought I'm a Trinidadian. Actually, they came and asked me if you are a Trinidadian. So that's the first time I saw a steel pan band on a truck, and I was so fascinated. What is this instrument? I've never seen this in my life. And then the moment I came to Trinidad, within the first year, I bought a steel pan. And
Ah,
then I started learning the steel pan with the Indian music, because I play a lot of Indian instruments,
right.
one in each variety, string and whatever it is. So when I was ready for the inaugural lecture, my dean asked, "What are you going to do?" He said, "Can I play the steel pan?" Because when I played it, I played a ghazal or something, and then at the end of the lecture, somebody Trinidadian came to me and said, "Prof, you play steel pan? Oh, my goodness, you came just now to Trinidad and you are playing steel pan. I am going to go and learn it tomorrow. At least I have to play Mary Had a Little Lamb."
You've inspired the locals as well. And if anyone is curious, Professor Harry has a YouTube channel, and that's where I actually listened to it with your inaugural talk. And at the end of it, he actually plays Indian music on a steel pan. Just fascinating. Last question, sort of combined here. What would you like to leave as your legacy, or rather, what is your message to the world? This is like a signature question on the Wormhole we ask all our guests.
Sure. Okay. You would have seen that I'm very, very humanistic, but I must say that I go beyond the humanistic. Every single thing or creature around me, right? So that is what I was telling about the spirituality. All I want is that we live as a society, as a community, and instead of um, you know too much squabbling about life before death and life before birth and life after death. That is what we are now fighting with all our religions, and the people, the Roe versus Wade is talking about not killing a fetus, but they don't want to stop a war. We have to think about humans after birth. How do we respect individually, and how we respect life, and how we respect the quality of life, and how we do not, shy away from death, and how we actually say that it is natural and have a dignified death. And in the whole, it has to be a dignified life from birth to death. And if we all get that message and be congenial and harmonious to each one of us, that will be the utopian world.
That's just fantastic, and a fantastic note to end it on. And I can tell you personally that you are making a difference. You are making a difference in the world. Anyone who comes in touch with you and follow up with your readings and things like that. So, Harry, this brings us to the end of our multi-part segment, first time for the Wormhole. And thank you so much for joining us for these episodes to discuss things that are so important to all of us. Thank you very much for being with us.
Thank you very much for having me. Thank you very much.
And guys, this brings us to an end of another episode. I am your host, Shirin Hack, signing off from none other than Studio 42, where we seek to find the answers to life, the universe, and everything. Bye.